Have you ever felt unexplainably tired for a long period of time? You might be experiencing chronic fatigue syndrome, or CFS, a complex and debilitating condition that goes beyond typical day-to-day fatigue. This persistent fatigue can be so severe that it interferes with daily activities and work, and it doesn't improve with rest. Current research suggests a link to underlying viruses or infections. Recognizing this condition is the first step. It's crucial to seek proper treatment and management strategies to improve quality of life. Now let's delve deeper into understanding this condition. So, what exactly is chronic fatigue syndrome, you might be wondering? Chronic fatigue syndrome, also known as CFS, is a complex and often debilitating condition that is primarily characterized by persistent, unexplained fatigue. This isn't your run-of-the-mill tiredness that can be fixed with a good night's sleep. No, this is a long-lasting, overwhelming fatigue that significantly hinders your ability to carry out everyday activities. But fatigue isn't the only symptom of CFS. It's like an iceberg, with fatigue being the tip that you can see, but underneath the surface there's a whole host of other symptoms. These can include muscle pain, impaired memory or concentration, and sleep disturbances, to name a few. It's not uncommon for individuals with CFS to experience headaches, sore throat, or even vision issues. Diagnosing CFS is no easy task, mainly because there's no specific laboratory test available. Instead, healthcare professionals have to rely on recognizing the symptoms and ruling out other potential causes. It's a bit like piecing together a puzzle, trying to make sense of the different symptoms and how they interact. Now, as complex as chronic fatigue syndrome is, it's important to delve deeper into understanding it. Not just for the sake of knowledge, but because understanding the causes and mechanisms of this syndrome is crucial to managing it. So buckle up, because we're about to embark on a journey to explore the causes of chronic fatigue syndrome in our next scene. What causes chronic fatigue syndrome? This is a question that has puzzled the medical community for years. We know that chronic fatigue syndrome, or CFS, is a complex condition with a multitude of manifestations. Unraveling its cause is like piecing together a difficult puzzle. Research has suggested that potential triggers could be linked to viral or infectious agents. Think of it like a switch that gets flipped in your body following an infection, causing your immune system to react in a way that leads to the onset of CFS. Moreover, emerging studies indicate the role of immune dysfunction in the development of this condition. It's as if your body's defense system is in overdrive, leading to a constant state of fatigue and other debilitating symptoms. There are also whispers of a genetic predisposition. This doesn't mean you're destined to have CFS if it runs in your family. It just suggests that some people may have a genetic makeup that makes them more susceptible to developing the condition. The precise etiology or cause of CFS still remains elusive. However, the medical and scientific community is relentless in their pursuit to understand this condition better. Ongoing research efforts are shining a light on potential causes and risk factors, bringing us one step closer to understanding this complex syndrome. And now let's look at some of the treatment options. But before that, we'd love to hear from you. If you're finding this video informative and helpful, don't forget to give it a thumbs up. We encourage you to subscribe to our channel for more insightful content like this. So how can chronic fatigue syndrome be managed? The treatment for chronic fatigue syndrome, or CFS, is as unique as the individuals it affects. It involves a multidisciplinary approach, calling on the expertise of various healthcare professionals such as physicians, therapists, and nutritionists. Let's explore pharmaceutical interventions first. Medications can be used to manage specific symptoms of CFS. For instance, pain relief medications can alleviate muscle and joint aches, while medications that aid sleep can help address the sleep disturbances often associated with this condition. But remember, it's not all about medication. Non-pharmacological interventions also play a crucial role. Cognitive behavioral therapy, or CBT, is a type of psychotherapy that can help individuals cope with the impact of CFS on their daily lives. It involves teaching individuals to change unhelpful patterns of thinking and behavior. Then we have graded exercise therapy, or GET. It's a structured exercise program that starts very slowly and gradually increases over time. The goal is to balance activity and rest, avoiding the boom and bust cycles that can exacerbate CFS symptoms. It's important to note that what works for one person might not work for another. The key is to tailor the treatment to the individual's symptoms and circumstances, with the goal of improving the quality of life. In addition to medical treatments, lifestyle modifications can play a significant role in managing CFS. What lifestyle changes can help in managing chronic fatigue syndrome? An essential part of any journey towards better health is adapting our day-to-day habits. When it comes to chronic fatigue syndrome, or CFS, making key lifestyle changes can be instrumental in managing symptoms and improving overall well-being. Firstly, energy conservation is crucial. It's all about pacing and planning your activities to prevent overexertion. Think of your energy as a limited resource that needs to be wisely allocated throughout the day. Prioritizing rest is also paramount. It's not just about getting enough sleep, but also taking short breaks during the day to recharge. Nutrition plays a significant role too. A balanced diet rich in fruits, vegetables, lean proteins, and whole grains can provide the energy needed and help the body function optimally. Hydration is equally important. Drinking plenty of water can help counteract the fatigue associated with CFS. Exercise, when done right, can be beneficial. It's about introducing gentle, graded physical activity, gradually increasing in duration and intensity. This can help boost energy levels, improve mood, and enhance overall health. Let's not forget stress management techniques. Practices such as mindfulness, meditation, or yoga can help reduce stress and anxiety, promoting relaxation and aiding sleep. Remember, these changes won't bring about immediate relief, but they're part of a comprehensive approach to managing CFS, and they can make a significant difference over time. Despite the challenges, recovery from CFS is possible. With the right strategies and support, you can navigate this journey towards better health and improved quality of life. Is recovery from chronic fatigue syndrome possible? This question has likely crossed the mind of those grappling with this complex and often debilitating condition. The answer, while not simple, is filled with hope. Recovery from chronic fatigue syndrome, or CFS, is indeed possible. It's not always a straightforward journey, and it varies from person to person. But let's be clear, improvement and even remission are within reach for many. Consider the numerous success stories of individuals who have managed to regain control over their lives. These are everyday people who, through comprehensive treatment approaches, have seen significant improvements in their symptoms. They've managed to reclaim their vitality, their energy, and their zest for life. These stories serve as a beacon of hope for those in the throes of CFS. They prove that with the right support and treatment, it's possible to navigate the murky waters of this condition and emerge victorious on the other side. But remember, this journey requires proactivity. It's about forging a partnership with your healthcare team, making necessary lifestyle changes, and above all, never losing sight of the fact that improvement is possible. Recovery might not mean a complete absence of symptoms for everyone. For some, it might mean being able to manage symptoms well enough to lead a fulfilling, productive life. The road to recovery from CFS may be a winding one, and it may take time. But with resilience, determination, and the right support, you can traverse this road successfully. Remember, professional help is vital in managing chronic fatigue syndrome. Your healthcare team can provide the guidance, the treatment options, and the support you need to walk this path towards recovery. So, what have we learned about chronic fatigue syndrome? Chronic fatigue syndrome, also known as CFS, is a complex and often debilitating condition characterized by persistent and unexplained fatigue. Symptoms can range from muscle pain and impaired memory to sleep disturbances. Its origins may be rooted in viral or infectious triggers, immune dysfunction, or even genetic predisposition. However, with a multidisciplinary treatment approach, incorporating healthcare professionals, pharmaceutical interventions, and lifestyle modifications, managing CFS becomes a feasible task. It's important to remember that everyone's journey with CFS is unique, and what works for one person may not work for another. If you suspect you may have chronic fatigue syndrome, we encourage you to seek professional medical advice. There are resources and support networks available to help you navigate this journey. Take care of your health, and remember, you're not alone in this journey.